Women undergo monthly periods. Some women experience pain, others don't. Did you know why? Well, I am Dr. Siraj, your women specialist, and in this video, we are going to discuss why some experience pain and others don't. So we are going to explain why other women are able to experience painful periods during their menstrual period, or what we call dysmenorrhea, and we shall call it causes of dysmenorrhea. We shall categorize them into two. Women who have never delivered, call them renal-paras, mostly experience what we call primary dysmenorrhea, or they have primary causes, which include, they are basically explained in terms of hormones, and majorly there's a hormone what we call prostaglandins. These hormones during periods, they tend to make the uterus contract, so that whatever you had prepared to nourish the baby, if you had actually conceived, would come out. That is to the advantage. But again, the disadvantage part of it is that it will cut off the blood supply to the myometrium and endometrium, and you end up with painful periods. And this one happens in younger girls mostly who have just started their age, or what we commonly call menarche. And as you grow, it may reduce, or after delivery, it may reduce. However, we also have what we call secondary causes. Among the secondary causes are things like, if you have things like adenomyosis, this is when you have abnormalities in your uterus. Things like fibroids, uterine fibroids will give you pain. Things like if you actually have an acute infection, like the pelvic inflammatory disease, you'll also experience pain. So in secondary, it means there is a problem that is actually causing you to experience or contributing to your pain. However, in primary, whatever is happening is normal, but because of how it happens, due to the hormones like progesterone, estrogen, you experience some bit of pain. But importantly, is that in secondary, we are able to actually find out what problem you have. And when you come to hospital, you go to your nearby health facility, the doctors there can actually do a checkup and find out of the very many we've talked about, adenomyosis, endometriosis, and then uterine fibroids, acute pelvic inflammatory disease, even acute infections like acute cystitis, acute pyelonephritis. Those are infections that can affect different parts of your reproductive and urinary system, and you end up experiencing pain. And when they are diagnosed, when you get appropriate treatment by your trained health workers, you'll be able to overcome the pain. So, how do we manage or treat painful monthly periods or menstrual periods? The treatment is actually available. One, we can do non-medical, or we use things that do not need drugs for swallowing. For example, you can use a warm bath. You just prepare warm water and bathe, and it's only enough to take away your pain during the periods. Then two, in case you can do some exercises, people go to gym to do some Kegel exercises, then they can also help you take away the pain. If those fail, then you can also come to us and prescribe for you some painkillers. Commonly, the best drugs to use are drugs like the NSAIDs, which include ibuprofen, diclofenac, myopaz also helps, and things like methylphenic acid can also help. If those ones fail, really we have to actually go ahead and really investigate and find out what would be causing the painful periods. And then girls who have never delivered, you are at a very high risk of experiencing painful periods. And usually in our settings, elders have told you that when you give birth, the pains will go away. Is it true? Yes, it is true. Because when you give birth, your estrogen and progesterone levels will be balanced and you may not experience pain during your periods. However, still other women who have delivered before still experience pain. That's when we come back and say, look into the aspect of secondary causes, investigate by during investigations like ultrasound scan, look at your internal organs and find out what the problem would be. Do you have fibroids? When the fibroids grow, uterine fibroids grow, they undergo what we call ischemic processes, and that process actually ends up giving you pain. And this pain is worse when you're having menstrual periods. So when this persists after using exercises, using warm compressions, doing exercise, then getting drugs, which I've already mentioned, but still your pain insists, please come or to go to the nearby health facility. Investigation shall be carried out and your problem will be treated optimally. And so I encourage each of you to visit the nearby health facility in case your problem persists for better management. So I remain Dr. Siraj, the women specialist, and if you're new on this channel, I encourage you to subscribe and follow for our updates, weekly updates. Thank you very much.